Of the International Agency of Research on Cancer, that's IARC. IARC is the specialized cancer wing of WHO. Welcome. May I welcome Mr. Dinesh Madhavan. Mr. Dinesh Madhavan is the President, Group Oncology and International, Apollo Hospitals Enterprises Limited. A warm welcome to Dr. Madhu Shashidhar. Dr. Madhu is the President and CEO, Hospitals Division, Apollo Hospitals. We welcome Mr. Harshad Reddy, Director, Group Oncology and International, Apollo Hospitals Enterprises Limited. Welcome Dr. Anupam Sibal, Group Medical Director, Apollo Hospitals Group. And we also welcome Dr. Anil de Cruz, Director, Oncology and Senior Consultant in Head and Neck Oncology, Apollo Hospitals Group. A warm welcome to all of you all. Please on dais. Thank you, sir, and thank you, everyone. Now, I would like to invite Dr. Anil de Cruz, sir, to share his thoughts on how Apollo Cancer Conclave is adding value to the global oncology scene. Sir, if you could, please.
Good afternoon, everybody, dignitaries, senior colleagues, and the press. First, I want to thank all of you all for coming here today. I have a bad throat. I'll be brief. I know we've gone over time and many of you all have got other appointments, but a very sincere thank you for coming for this press meet. According to me, as a senior doctor, the press is a very powerful medium to take the knowledge of cancer to the public. Briefly, the Apollo, I think some of you all must have been part of the inaugural ceremony and you heard my comments. Apollo has always been on the forefront of service, treatment of patients, best infrastructure, accredited hospitals, cutting edge technology. But we are also now placing emphasis on education, research, and outcome measures to improve outcomes in our cancer patients that we treat. And one of the modes of doing this is knowledge sharing. And the Apollo Cancer Conclave started in 2014. This is the 7th edition. We plan to do it every 2 years, rotating across the various centers in our country, and we've got 29 cancer centers of the Apollo within the country. The theme this time is contemporary to precise. So we're going to discuss regular treatment plus the recent advances. At the Apollo Cancer Conclave, our theme, our message, our efforts are to tell every clinician, every delegate who attends this meeting how they can make a difference in outcomes for cancer. We had a wonderful keynote address by Elizabeth and she's going to speak next. So many cancers are 75 to 100% preventable. And that's where we need your support to take this message out to the I'm not going to go on about that. I'm going to hand over because we've got other dignitaries who are going to speak. So with these few brief comments, I will pass the mic on, but we'll be very happy to take questions from any of you all at the end of comments from the leadership who are on the dais.
Thank you, sir, for sharing your thoughts on this and also making it possible as the chairperson of this year's conclave. I would like to invite now Dr. Madhu Shashidhar to tell us about Apollo Hospital's vision for the future.
Thank you. Let me start by reiterating what Dr. Cruz said, because those of you who are here from the media, and I see some familiar faces, I think you have a very, very important job that you do, and that is to educate the public. I think there are at least two key takeaways that I think of when I look at this conclave. The first is that cancer is preventable, and you heard that from Dr. Budapest. The vast majority of cancers are preventable based on lifestyle choices that we make today. It takes a long time, and getting that message out, I think, is a key role that media plays. The second message is that cancer is potentially treatable. But in order to treat cancer, you have to detect it and detect it early. So I hope you will take that message to your readership. As Apollo looks to the future, we see that healthcare will fundamentally change in many ways. There are a lot of technologies that are driving change, and you hear about that all the time. Whether it is artificial intelligence, robotics, nanotechnology, the use of artificial intelligence to guide medicine, genomics. You'll hear a lot about genomics during this conference. But to me, the biggest driver of where healthcare will go will not be technology, but will be the patient himself or herself. Patients are going to become much, much more educated, much more aware of the choices, and they're going to exert those choices. They will want the right care at the right time with the right person, and they will also choose how they pay for it. And all of this will change how we deliver care. This will mean more virtual care. This will mean more ambulatory care and home care. There will be increased penetration of insurance, and that will determine how patients will come to us for care, including potentially coverage for some of the screening that we're talking about. So that's where we are preparing ourselves for. We see an aging planet, aging India over the next 2 to 3 decades, and a significant workforce shortage. We also know that our current workforce needs to be educated and be prepared to take care of the pathologies of the future. So I think these are the broad trends where we spend our time thinking about how to solve for tomorrow's problems. Thank you all for coming. Thank you.
Thank you, Dr. Madhu, for explaining very lucidly where Apollo stands for bringing in a change in cancer care. Now, if I may request Mr. Harshad Reddy to share his thoughts on this year's Apollo Cancer Conclave.
I'd firstly like to start off by thanking the beloved members of the media who are present here today. You have been an integral part of why India is being recognized globally for the healthcare services we provide, and I sincerely appreciate all the work that you do. As already mentioned, I think you also play a very important part moving forward in terms of spreading the awareness of living a good and healthy lifestyle and early detection towards cancer. So appreciate all your efforts. With regard to the significance of this conclave, it is the 7th edition of the Apollo Cancer Conclave, and it is our mission to foster knowledge sharing, collaboration, and advance cancer care. Today, India is uniquely positioned to become world leaders when it comes to far-reaching advancements in cancer care and oncology services. It's purely because of 2 reasons, I would say. One is the excellent skill set that our clinicians possess. 2, the large volumes and diversity that we see within our patient population. Today's event is just one step in that journey for us to battle in our battle against cancer. This is an event that we'll continue to do as we progress, and we look forward to your support as well.
Thank you so much, Mr. Harshan, and also for the patronage for making it possible, including including this year's conclave. Now, if I may request Mr. Dinesh Madhavan to please share his thoughts about Apollo Cancer Center's vision for the future.
Members of the media and my other friends in this August gathering, the next 3 days there's going to be multiple deliberations around medicine and largely focused on the 7 tracks in cancer. And I urge each one of you all to participate, to talk to our clinicians to understand more. What I'm going to talk about is not what Apollo Cancer Centers can do on the therapeutic part alone, but how we need to work with governments to create policy. We have an average about 1.4 million new cancer patients being diagnosed, but 50 to 60% of those can be prevented. The medium called the press needs to raise awareness through communication, through your mediums, digital and offline, to have people educated on how they can actually prevent cancer. That's one of the steps from my end which I think should be taken up strongly through the media. Second is close to 1.4 million cancers are diagnosed every year. Close to 1.4 million can be totally avoided, or cancers that we can ensure isn't burdened by banning tobacco and tobacco products by the end of the century. Third, we are looking at cancer from an ecosystem today where patients are coming in stage 3 and 4 because we're not creating an ecosystem to pick cancers early. And the repositioning needs to be done on how do we create policies through government and through clinicians who are on this forum to create a notification which will ensure that the government of India makes sure that cancer is a notifiable disease across India, which currently for close to 50% of the states doesn't exist. Fourth, most cancers, in most countries, over 100 of them, cervical cancer is a mandatory vaccine. In India, it is still not seen as a mandatory vaccine. Sometime in 2008, the ICMR came out with a study to make cancer as a notifiable disease. We still haven't seen this implemented. So the future of cancer will depend on 4 or 5 factors. One, how do we notify that as a disease by the government in every state so we understand the burden of the disease and take steps to mitigate the burden. Second, how do we ban a set of products which increases your incidence of cancer? Third, how do you prevent a set of cancers which can be prevented? Fourth, how do you create an ecosystem to reposition from stage 4 to early stage so that you can win over the disease? 5, how do you create the next generation of clinicians and caregivers which are acute shortage in tier 2, tier 3 cities? All this would need private enterprises like Apollo Cancer Centers and the government of India to come together to create policies which will create the paradigm shift in cancer care. And hopefully, while we get to see in 2026 to live with about 100 cancer survivors, we probably would see the decade after that we co-live with people who win over cancer. Thank you.
Thank you, sir, for setting up the stage for the press as well and sharing with them what is there in offering in future by Apollo Cancer Centers. Thank you. And now I would like to request our esteemed guest, Dr. Elizabeth Weidepass, to share a note on a topic which is dear to all of us probably, and we all are striving for. That's our dream. That's a world where fewer people develop cancer.
Thank you very much. Good afternoon, colleagues of the press. My name is Elizabeth Weidepass, and all what I'm going to say is available in the website, which is www.iarc.who.ent. I will repeat, www.iarc.who.int. I will give you some numbers about for you to have an idea of the burden of cancer in India. As my colleagues already cited, every year at least 1.4 million patients are diagnosed with cancer in India. In men, the top cancer types are lip and oral cavity, 16%, lung cancer 8%, esophageal cancer 7%, colorectal cancer 6%, and stomach cancer 6%. For women, breast cancer is the largest burden. 27% of all cancer cases in women are breast cancer. Cervix uteri 18%, ovary 7%, lip and oral cavity 5%. So many patients survive, but unfortunately many patients died. Our estimates is that at least 960,000 people die in India every year because of cancer. Most of these deaths are evitable. Many are evitable if patients avoid risk factors, and in India main risk factors are tobacco, areca nut, and other forms of tobacco and products that people chew. Very, very important. And as doctor already mentioned, for women in particularly HPV, human papillomavirus vaccination. The Indian government is scaling up vaccination in different states at different rates. As soon as the vaccine is becoming available, I strongly recommend mothers and fathers to make it available, in particular for the girls. The target age is 19 to 13 years. Is where the immune response is optimal for the vaccination against HPV. The HPV means human papillomavirus. The vaccine is so effective, it's almost 100% effective, and we can think of a world under India as a country or a subcontinent free of cervical cancer in the next decades. But we really need you to pass the information. The vaccine is safe, is efficacious, and is widely recommended. And as soon as it becomes available, we strongly recommend parents to have, in particular, their girls vaccinated. So this burden of cancer will increase, and until year 2050, basically we are going to see twice as much patients getting cancer and very unfortunately dying of cancer. Therefore, the efforts that the Apollo group and the oncology community is doing in India is so important, because these numbers, they will affect all families. No family will be immune for cancer. And it's very important that you, as members of the press, inform the population how to protect themselves, their children, and to avoid the very high burden. If a person unfortunately gets the disease, it's crucial to get diagnosed earlier. The earlier you get diagnosed, the better the prognosis and the lower the mortality. This is a fact for almost all cancer types. So as soon as a person gets a symptom, search for healthcare. It's crucial. Thank you very much.
Thank you, Dr. Elizabeth. It's a privilege to have you with us and to share the message with media that how cancer is becoming even preventable with vaccine. So with this, I would like to now open the floor for the media to take questions and answers by our delegates and dignitaries.
Hi, I'm Sanjukta Sharma. I write for Hindustan Times and Mint newspapers. This is a question to you, Elizabeth Whitepass. Yes. I want to know, so in India and everywhere really, like the news is always very gloomy when it comes to cancer, right? There's more burden in India, even cervical cancer, there's a huge percentage of mortality and etc. etc. I want to know from you, say in the past 2 decades or now, what are some of the things in terms of prevention as well as treatment that you're most optimistic about that could be a game changer, say, in the next decade? This is also a question to the experts from Apollo Hospital to tell us about the Indian context. You know, what should we be most excited about, most optimistic about for the next decade?
Thank you so much for this very interesting question. So let's go back to the Indian reality. Indeed, many of the news are gloomy for the reason that India is an emerging country in many ways. But we are seeing progress, a lot of more professionals being treated, and a lot more awareness regarding risk factors and the importance of early detection. Let's start with women. the main cancer types in women in India today, as I mentioned to you, breast cancer, 27% of cancers among women are breast cancer. This is massive, it's really huge. What women can do? Women can avoid using hormones when they are turning menopausal. You know, when a woman turns menopause, there are lots of symptoms, and usually women were used to take hormones to prevent the symptoms or to decrease the symptoms. Many times this is advisable medically, but the limitation of the duration of using the medicines is very important, and use a low dose. Also, women can avoid becoming overweight and obese after menopause. Usually, when we turn menopausal, we tend to put on weight for hormonal reasons. That's an important risk factor for breast cancer. But even if the women do everything right, many women, half of all breast cancer cases occur in women that have zero risk factors for breast cancer. So if awareness, any changes in your breast, and that you can yourself feel or have a healthcare professional examining your breasts regularly, that's already something is better than nothing. Actually, most of the breast cancer cases are detected by the women themselves because they feel that there's something strange going on. Changes in the skin, a lump, or something different in the breast, a discharge of the nipple. Some women have access to mammography screening. Mammography screening is a good way to detect breast cancer early. Not all women have access to it, but if women have access to it, in particularly between ages 50 and 65, it's advisable that they do eye screening every second year. However, even so, many women that do palpation, that do mammography screening, and that have no risk factors, they will still develop breast cancer. Maybe they have a genetic susceptibility. In any case, the important thing and the good news is that breast cancer is highly treatable, in particularly if detected early. So women that have a breast cancer detected in early stages, almost all of them survive 5, 10, 15 years, and they happily die at old age by something else, like cardiovascular disease. So breast cancer is common. Most of the women here will face it in themselves or in their family members. We should not be afraid of it. But we need to act fast, and women need to be aware and not to be ashamed when there is something different in their breast, to talk to a healthcare professional as soon as possible to get it diagnosed and treated. Very good news, the treatment now is so efficacious that if women search healthcare, even if they have never been screened before, their survival is almost the same as if they were screened before, but they need to go early.
So thank you, Ms. Sangeeta, for a very pertinent question.
I'll make a comment as a clinician. As a clinician, 33 years in cancer, I'm optimistic that we can prevent half our cancers. We can have early detection and have an 80 to 90% cure rate for the majority of our cancers. I'm only going to quote the #1 cancer in our country which I treat, oral cancer. It's because of tobacco. Even if we find it difficult to ban tobacco, we can tell people not to consume, and any dentist, any ENT, any doctor just peeks into the mouth of someone, we can get them in stage 1 or in a pre-malignant stage and cure close to 100%. And I think that message should be taken. We always talk about the fancy new treatments, immunology, various other things. And the other message is that even the plain areca nut, which is the supari, is a grade 1 carcinogen, class 1. So we have to take these kind of powerful messages to the people, and I think, like everybody said, you all have to do it.
If I could just add for 20 seconds, I'm going to echo what the two doctors said, both as a clinician and as an administrator. I worked with lung cancer throughout most of my career. And in the early part of my career, it was not a curable disease by and large. And that changed. That changed when we figured out that we could use low-dose CTs to detect early cancer in the right patients. And the message here is that the biggest impact in healthcare outcomes have not come from medicines, as Dr. Tiku said, right? There have been some like streptomycin for tuberculosis. Most of it has come from public health measures, polio vaccine, sanitation, childhood vaccination, right? Better nutrition. And this is the era for us to take that paradigm to cancer, right? Prevention, healthy habits, and early detection when possible. So I think this is where, and the current generation is very savvy and very health conscious. I think it is our job to get this message out.
Thank you. So, yes, please.
Hello sir, I write for PW, I'm Sambhav, I write for PW Healthcare World. So, very recently custom duties has been exempted from 3 cancer medicine that we all know. So I have a question from experts on the dice that what are the specific expectations from you guys to the Indian government so that cancer care can be made affordable for middle income groups?
Let me just add a quick comment. So I think affordability and accessibility are going to become issues, right? And you addressed one big component, which are medications, right? We do have to figure out ways in which medications, especially newer generation medications, are available and accessible at a lower cost. I think the other component of this are devices. Devices that we use today to diagnose and treat cancer are still incredibly expensive. There is a need to either produce them in India or have lower cost options that are available.
I was recently at a summit, and just to answer the previous journalist question and yours, what is the expectation and optimism? I'll just draw a corollary to another condition called tuberculosis. And if you look at the policy on a communicable disease which happened is to create what is called a policy to eradicate it, right from making it mandatory to be notified, then actually documenting who's got tuberculosis, creating across districts what are called tuberculosis institutes, and then creating the care pathway and actually setting up a process to make sure that we live in a world without it. Unless you do that, we could have, like Dr. Tikru said, all the fancy drugs under the sun, or any process that you want to create a technology and device is less going to be achieved. To me, for a country of 1.4 billion, the moonshot movement has to be created by the government of India, like how the US did it under the leadership of Nixon. The change in living with cancer in the US did not happen without policy making which stood up to what is the change which has to be seen. So the biggest optimism I see is the recent bill which got passed in the Rajya Sabha, which is moving to get a legislation to be done in the Lok Sabha. The earlier the better, and to me that will change the entire landscape of oncology seen in this country. That's one. Second, what else would I expect from the government? Can there be incremental coverage, like in most countries, which is given, whether it's a national health policy or an individual policy, where you have a coverage much more than your average cover for healthcare? The biggest problem in India is underinsurance. It's not the number of people who are insured. It's the quantum of insurance that each one carries. And people would walk around probably with a coverage of less than 1 lakh and say I'm insured, but you hardly get any care. Third is in the nationalized schemes which the government runs, how much of them gives you today access to an advanced care is a big question. These would be largely 3 steps, but if you look at between the 3 of them, it means policy decisions that between public and private which needs to be created to actually look at how do we live with the world which is more meaningful whether you have cancer or not.
Thank you. That's a very important message. Mr. Sambhav, thank you for asking the question. Any more questions, please?
Hi, Kalyani Sharma from Express Healthcare. My question is for Mr. Madhavan. So you mentioned about training the next generation of clinicians and healthcare professionals. So what are some of the specific skills and training programs that are critical right now, since so much is happening at the technology front?
So we do also have, in addition to what I'm going to answer, a display session in hall number 3, where we have multiple of our accreditation program fellowship programs, the engagement programs which were listed out there. So I'd also urge you to visit the stall and get access to more information than I give. But the gap has been largely on the number of oncologists that we have who would probably need to diagnose cancer or who probably need to treat cancer, be it adult or childhood. The ratio of the number of consumers who actually are diagnosed with early stage cancer, late stage cancers, and the number of oncologists who are available to treat them between a metro and a tier 2 or tier 3 city, there's a huge disparity. And what you would probably need is to have more clinicians who are passing out and organizations like us who mentor and teach the next generation of oncologists so that the care gets more optimal than what is today. We have taken some steps in this direction, and a little later, if you have time with the press meet, I would request you to meet up with Dr. Anupam Sithan, who would probably give you a little bit more insights on our DNB programs and an FNB program. Anupam, I'd request you to give us some insights on it, so you could get into detailing of it. But I think the need is actually to create the future of the cancer care pathway with some clinicians who would step forward to actually looking at the burden and see how we can mitigate it.
Thank you.
Hello. Ma'am, good afternoon and welcome to India for this conclave. My question is for you, like how you look at India when it comes to preventive care.
Thank you very much for this important question. India has been doing a lot and has been acting towards increasing prevention. There are many pilot initiatives and many statewide initiatives as well. The most important, which in my view, is the initiative on HPV, expanding the production of human papilloma vaccine and are aiming to vaccinate the whole country in the next decades, and therefore eliminating cervical cancer as probably the first cancer type that we will be able to eliminate in the face of this world, including India, which is a highly affected program. India has also a problem of using vaccine against hepatitis B, and that's very important. There are some initiatives in screening and detecting hepatitis C, but they are not yet scaled up. So it would be important to look in the opportunities to diagnose and treat people that are already infected with hepatitis B. There are initiatives on screening, but they are not really population-based. They are scattered and they are disorganized. So it would be recommendable that a more organized screen is implemented for the women that have not vaccinated for HPV vaccination, for example, for cervical cancers. We are very sure that for cervical cancer, screening for the unvaccinated women is effective. And now we have a new technology to detect it, which is detecting the HPV virus in the women. So before we used to use cytology, but cytology is quite complicated. And now we have demonstrated that HPV testing, human papillomavirus testing, if the woman is or not infected, is a more effective way to check if the woman is or not susceptible for cancer. This is being scaled up in some parts of India, but not generally. So all of this needs to be packed in a national cancer control program. That means an overarching program for all of India, indicate clearly which are the priorities, what should be tackled in which order, in which chronology, and with a budget. And then is the budget coming from the central level or for the state level? That's not up to me to decide, it's for the Indian population and the representatives of the government. But it's very important to understand that cancer is not going to go away. And that India needs to think on the long term, how to prevent, detect early, and treat the tsunami of people that they need to treat.
Thank you.
Thank you.
I know how busy you are. One election just ended and you have another election to cover in 12 days. A very important election because Maharashtra contributes 13% to the GDP of India. So really value your taking out time. बहुत बहुत आभार आप आए यहाँ पे. Just want to ask everyone a question. Anyone here who has a friend, a relative, a colleague, a neighbor who has cancer or has had cancer? I mean all those who've had someone, right? And this happens everywhere now. 70% of hands go up because we are seeing a lot more cancer than we did. I mean, if you look at the incidence in 2020 and you look at predictions in 2025, in 5 years, 12.9% increase. So that's pretty substantive. What we are also sadly seeing, and if you look at breast cancer as an example, the 5-year survival rate in India is about 66-67%. In the West, it's upwards of 90%. And it's not because we don't have the expertise. We clearly have some very bright doctors. It's not that we don't have access to imaging. It's not that we don't have the ability to categorize the exact pathology in the breast tumor to be able to give the right therapeutic regimen, which might be a combination of surgery, chemotherapy, tailored chemotherapy and radiation. We have proton therapy, we have all of that. But then why is it that our survival figures are lower? And the answer to that is because we just pick up things very late. So I want to ask another question. Everybody here would have a vehicle. When was the last time you had it serviced? Last 1 year, right? And when was the last time you actually went for a preventive health checkup? Everybody says, I saw a doctor in the last 1 year. Yeah, you had a sore throat, you had a viral, you had to see a doctor, right? But when did you actually go to see a doctor when you were feeling fit? And you know that figure somewhere in our country is 20 to 30%. So we attach a lot more importance to a car, which we can buy, but not our life, which is priceless. And this is a mindset change that we request the media to address. Please value your life. A lot of people's happiness depends on how healthy you are, and all it takes is one health checkup once a year to be able to pick up things at a stage where they could be curative. When it comes to cancer, if you pick up a lesion when it's amenable to surgery, you will not need chemotherapy, you will not need radiation, and your cost will perhaps be 20% of what it would be if it's stage 4. So we really need to start thinking about our health. We need to focus, and if we did that, we will have better outcomes. And we also need to focus on vaccination, and a lot has been said about it. Taiwan saw hepatitis B as an endemic disease, and in the mid-80s they launched a vaccination program, universal vaccination, first country in the world to do that, to eradicate hepatocellular carcinoma and hepatitis B. And from a country which had the highest endemicity, there will be no hepatitis B in Taiwan in a few years from now. That is the power of vaccination, and we have that power. Hepatitis B vaccination is universal as part of the immunization program in India, but the next other vaccine that we have to focus on is HPV. And it's been around for quite some time. We talk about it, but I think we need to create awareness. So two parting messages really. Think about preventive health checks when you are healthy, and think about what is it that you can do in terms of prevention. Vaccination is something that we've talked about. And of course, consumption of tobacco. We really have a serious problem with oral cancer. And then of course, we can get into the specifics of prevention for other cancer. Thank you very much. Deeply appreciate your presence here today.
Thank you, sir, for giving the very needed personal connotation to it. We have a small audiovisual clip for you to see what we have in this conference. Yes, sir.